What's up, beautiful people? Another day, another study. So, I'm going to be talking a lot more about women's health, specifically around menopause and perimenopause. It's a topic that I used to talk about, I stopped talking about because myself and I saw other evidence-based content creators just get flamed by women because we're men and men don't know anything about hormones or women's bodies and just leave it to women to talk about this stuff. Well, I learned about hormones in pharmacy school, learned about hormones in medical school, learned about hormones as an internal medicine resident. Used to treat a lot of women until that backlash started happening. And it was wrong of me to pull away, right? It was a disservice to patients because it's an area of extreme predatory behavior online. And so many people are taking advantage of women during this very vulnerable period. So, anyway, I want to give a shout out to Dr. Dwyer, who encouraged me to come on here and talk about women's health more. So, here we are. And also at Nimbus, our other provider who was doing our women's health line, she retired. So, I'm stepping in now, seeing our women's patients. And I'm actually going to be revamping the line. I'm taking a 3-day course right now, learning a lot, but it's along the lines of my philosophy. And I'm a big preventative health guy and metabolic guy. Those are like my number one and number two things. So we're going to transform our women's line around those as well, helping with the menopausal symptoms. But also, what a lot of people don't know and what isn't talked about enough is menopause is a change in metabolic functioning as well. We know the loss of estrogen changes glucose metabolism, changes the way the blood vessels work. Those are the vasomotor symptoms that happen. It changes lipid metabolism. It changes where our body fat is distributed. It can change mitochondrial function, right? Brain function. So a lot going on metabolically there. And I'm going to be adding in my comprehensive metabolic evaluations. So anyway, let's talk about what the study goes, because I just went off on a tangent. Menopause is a condition primarily driven by withdrawal of estrogen. There are a variety of symptoms that can happen. And we know that metabolic changes, such as redistribution of body fat, I mentioned that earlier, to the abdominal and visceral compartments can accompany this. And it's kind of a chicken and egg. That happens, and then menopausal symptoms are worse, which then can lead to behavioral changes that make abdominal and visceral fat more likely to happen, and so on and so forth. And we know abdominal obesity is a recognized risk factor for several different diseases like high blood pressure, diabetes, high cholesterol. And previous evidence suggests that women with abdominal obesity have greater menopause symptom severity, particularly with insomnia and vasomotor. That's the hot flashes, night sweats. So this study used something that I recommend that all of my patients do, that track this, the weight to height ratio. It's a great way for telling abdominal obesity. It's more sensitive than waist circumference, waist to hip ratio, and it's super easy to measure. And they're looking at that, and they're looking at people's menopausal symptoms. Actually, they had peri and premenopausal people in this study, and they're looking at the difference with abdominal obesity and without. So the abdominal obesity group reported higher prevalence of dizziness, hot flashes, night sweats, waking up in the middle of the night to go to the bathroom, sleep disturbances, and palpitations. And dizziness, hot flashes, night sweats, and other somatic, which is just kind of like body feel, like muscle aches, joint aches, that kind of thing, had higher symptom severity in the abdominal obesity group. And now what's interesting is symptom clusters were also different in the abdominal obesity group. And those with abdominal obesity, and that's a waist to height ratio greater than 0.5, forgetfulness, irritability, and night sweats had the highest centrality. And what centrality is how likely one factor is to either influence or be influenced by another. So it's like what kind of clusters together, what influences each other. While those without abdominal obesity, night sweats, palpitations, and depression had the highest centrality. And another interesting finding is that the vasomotor symptoms co-occurred with sleep disturbances in the same cluster, but this pattern was absent in those with abdominal obesity. So why are studies like this helpful? Because when you're looking at a constellation of findings and they can have multiple different things going on, if you know certain things cluster together, you tend to see improvements or worsening in those things in the same direction. And it can really help you figure out if that trend is caused by one thing or multiple things, and then where you need to divert your time, attention, and resources to. So, knowing information like this is really, really helpful in personalized medicine and figuring out individual plans and doing the best you can for the person in front of you.